So my project is hematology by me, Crystal Santiago. What is hematology? Hematology is a branch of medicine concerning the study of blood, the blood-forming tissue, and the blood diseases. Hematology is practiced by specialists in the field who deals with the diagnosis, treatment, and the overall management of people with blood disorders ranging from anemia to blood cancers. Diseases. One of the diseases that hematology covers is sickle cell disease. Sickle cell disease is caused by a genetic abnormality from the gene from hemoglobin, which result in the production of sickle hemoglobins. When oxygen is released from the sickle hemoglobins, it sticks together and form large rods which damage and changes the shape of red blood cells. The sickle red blood cells cause the symptoms of sickle cell disease. And here's a picture. The circle one is a normal blood cell, and the one that's question shape is the sickle cells. Symptoms of sickle cell crisis includes severe pain, anemia, chest pains and difficulty breathing, strokes, joint pains and arthritis and bone infractions, blockage of blood flow from the spleen or liver, and severe infections. Patients with sickle cell disease may develop severe pain in the chest, back, arms, legs, and abdomens. Pain can occur anywhere in the body. Sickle red blood cells in the lungs can cause severe illness with chest pain, fever, and difficulty breathing. Sickle cell disease can also cause permanent damage to the brain, heart, kidney, liver, spleen, and bones. The severity and symptoms vary greatly from person to person, even within the same family. Boom. Children are born with sickle cell disease. It is not contagious. It occurs when a child inherits two sickle hemoglobin genes, one from each parent. About 2,000 babies are born with sickle cell disease each year in the United States. People who inherit only one sickle hemoglobin gene are carriers of the sickle cell traits and do not have anemia or pain from sickle cell crisis. They may, though, have a slightly higher incidence of certain conditions such as blood in the urine or urinary tract infections. About 2 million Americans have sickle cell traits. How is sickle cell disease treated? Treatment of sickle cell crisis include opioid pain medication, for example, morphine, anti-inflammatory medicine, for example, ibuprofen, antibiotics for infections, oxygen, intravenous or oral fluids. Transfusion of red blood cells are given for severe anemia to prevent stroke or before surgery. Sometimes an exchange transfusion is performed with a special machine that removes the abnormal sickle red blood cells and places them with normal blood cells. And then here is a picture of my beautiful cousin who was born with sickle cell disease. You could tell in the picture that she is getting oxygen, and she also was getting a blood transfusion. Okay. What is the outlook for people with sickle cell disease? People who have sickle cell disease has a reduced life expectancy because of improvement in treatment, people with sickle cell disease now live longer and have a better quality of life. In 1973, the average lifespan was 14. But people with sickle cell disease now live into their 40s and 50s, and in some cases beyond the age of 60. Long-term treatment with hydroxyurea may prolong survival. Let me see. And that is the end of my presentation. I found all my information on medweb.com and some on YouTube also.